Hi everyone. Wanted to come to you today and talk to you a little bit about research. I've made a couple posts about this lately, but we have another glaring example of trouble in the research community when it comes to medical research. So I've talked before about the value of science and the value of scientific research, especially for doctors like me, functional medicine people, and kind of deciding what's right for patients and what's not, what diet is right, what supplement is right, what do you expect to see with, one approach or another. So science is important, I use it all the time. But you have to be able to read and understand science, much like you would read and understand advertising in this day and age. Somehow when you get a flyer in the mail that explains how wonderful this new thing for your house is, we all read that with a skeptical eye, right? We know it's advertising, they're trying to get our money. I want to make sure this is right. I want to go see it and whatever. But somehow with medical research, we're just supposed to take the headline and not ask anything else. So I wanted to give you an example, very recent example, of what I would plainly call bad research. Well, bad depending on your point of view. I'll get to that. So there was an article recently published in the New England Journal of Medicine, prestigious peer-reviewed journal, right? And it was about vitamin D and fish oil, but predominantly vitamin D, and their impact on your risk for heart disease and cancer over a period of time. They said it was equivocal whether or not it made any difference. I think we could argue that, but nonetheless, they did the research. I want to say like 65,000 participants, something like, or maybe it was 25,000 participants, but a good number of participants over a period of years. I think it was men over 50, women over 55. Anyway, so they took baseline measurements on everybody, ruled out anybody that already had cancer, I guess, and heart disease. And then they gave them all, well, half of them, 2,000 IUs of vitamin D a day, and I think a gram of fish oil. And then some of them didn't get any of it, and then they followed them over time to see what their rates of cardiovascular events and cancer were. And they came back and found that they were a little bit less for the most part in the vitamin D and fish oil group, but not significant enough to reach any statistical significance. So they said, headline was, vitamin D basically makes no difference in your risk for cancer or heart disease. Pretty simple. And that's the headline that will be perpetuated, I don't know, for however many years they talk about this article. But there are a couple of really big, glaring, significant flaws in an article like that, or in the research. One of which, my issue, they use the same dose in everybody. If I have patients in my office with vitamin D deficiencies, they don't all get the same dose of vitamin D. To some degree, it depends on how deficient they are. If you're aiming for a vitamin D level of 50 to 70, and you have someone come in with a vitamin D level of 10, they're likely going to get a different level of supplementation than someone who comes in with a level of 40. Level of 40 needs some mild supplementation, level of 10 needs dramatic supplementation, right? So it varies. Had they done the research and instead of saying, we're going to give everybody 2,000 international units a day, if they had said, we're going to bring everybody's blood level of vitamin D up to 55, some people would be taking 5,000, some 10,000, some 2,000, and they would get everybody to a blood level of 55, monitor them over several years, and then see what their risk level was. That would make a lot more sense than giving everybody 2,000 units and saying, well, they're no different than the control group. Some of the group was probably deficient, some of the group was not. Some of the control group was deficient, some of the group was not. Giving 2,000 units to someone who's grossly deficient doesn't really do them any good. Giving 2,000 units to somebody who already has enough doesn't change anything. So your research ends up being very fuzzy. You end up getting equivocal results. If you had taken that treatment group and divided them into people who were deficient to begin with and people who were not, and then people whose blood levels were restored to an appropriate level and people who were not, and teased the information out that way, you would likely get a significantly different result. And the reason I can say that is because there has been research done that was more like that got a significantly different result. So that was one issue. Another issue is, what are they aiming for with a vitamin D level? Right? The lab says anything over 30 is pretty much normal. Most functional medicine doctors will aim somewhere between 50 and 90. Many people between 70 and 90. And I think there's plenty of research to indicate that that makes some sense. They've recently increased the RDA for vitamin D. I think it was just in the past 2 years. I think they doubled it. So there's some acknowledgement that common knowledge several years ago has shifted significantly with the research we've gotten so far. That's another issue. What are they aiming for, right? Where are they starting? We don't have any of that information. Quality of vitamin D supplementation, quality of fish oil supplementation. They don't make any mention of that. So we're not sure the quality of the vitamin D supplementation. I will also say there is emerging research. Recent research. I wouldn't say emerging because I think there's been enough of it that we know, but it's recent, that having vitamin K along with the vitamin D makes a huge difference in whether or not your vitamin D can actually work. There are some suggestions that taking too much vitamin D can cause calcium to deposit in your arteries. And I think the theory there is vitamin D pulls minerals in from the digestive tract, but vitamin K helps you move those minerals from the bloodstream into the tissues and cells where they're supposed to be. If you have a lot of vitamin D and you're pulling in lots of minerals, but you're deficient in vitamin K and you can't move them on to where they need to finally go, they could hang around in the bloodstream and get deposited places. I think that's plausible. But if you take vitamin D along with vitamin K, that really shouldn't happen. So if you're doing a research study like this, I think you should also either test people for sufficient vitamin K or do what we do in practice. And most doctors that do what I do will give vitamin D that includes a small amount of vitamin K. Now, it's not equal parts D and K, and there are different forms of vitamin K, right? So it's got to be the right blend of forms. But that makes vitamin D work much more effectively. Vitamin D is a fat-soluble vitamin, as is vitamin K, as is vitamin A, and as is vitamin E. So if you give D by itself, or K by itself, or E by itself, and you don't have some of the other fat-soluble nutrients with it, it's just not going to work as well. It's not the way it was designed to be presented to your body. If you're eating a liver and it's got some vitamin D in it because it's got some fat content in it, it's going to have some A, right? So anyway, I just think it's disingenuous to do a study where you take what in most practices is going to be considered a not meaningful dose of vitamin D. You give it to a lot of people over a period of time, having no idea whether or not they're deficient. You come back and say it really didn't seem to make much of a difference, and then the headline simply says, don't bother supplementing with vitamin D if you're worried about inflammatory conditions like cardiovascular disease or cancer. It makes no difference. But there are plenty of other research studies that indicate, for example, people with the highest blood levels of vitamin D have the lowest incidence of things like breast cancer. So how do you take those two studies and say that they can exist in the same universe, right? There's a problem there. This study also passed the peer review process, which means other doctors or medical researchers read the study, evaluated it, and said, looks good to me. That's a major problem. And as I've said before, we rarely come across true, actual science anymore. What we have is this weird blending of science and marketing, right? Sometimes a little more heavy on the marketing, as this article likely is. This allows for a headline in the New England Journal of Medicine that says, don't take vitamin D, it doesn't do you any good. So when you go to your doctor and ask, look, I read an article about vitamin D, or I saw this blog post on vitamin D, I thought maybe I should talk to you about it because it says ask your doctor if you want to take vitamin D. You've got a doctor that had almost no nutritional training in medical school, most likely, has been working very hard and not really having a whole lot of time to update him or herself. And then they see this headline, likely on the news where you saw it, that says New England Journal of Medicine, vitamin D doesn't do you any good. So what are they going to tell you when you ask about vitamin D? New England Journal of Medicine said it didn't do any good. But the article is complete junk. It is bad science. It's not designed well. It really doesn't tell you anything except that the medical community doesn't want you taking vitamin D. Your guess is as good as mine why they wouldn't want you taking vitamin D. But that's basically what the article says. Now, every health reporter that gets this press release from some pharmaceutical company that says, hey, tell everybody vitamin D doesn't do any good, they just get on the air and read the headline. It's the New England Journal of Medicine. Why would they question it? Well, now you understand why we have to question it. Science is no longer science. Most of it is marketing. There is an agenda to everything. So just be aware. Know that if your doctor hasn't read the report, if your doctor hasn't thought about it, and if your doctor doesn't understand the background behind how vitamin D works or how it should be properly studied, you can ask your doctor till the cows come home. You're not going to get a legitimate answer unless that doctor understands the subject you're asking about. Right? If you read something on a package of cosmetics that says make sure you check with your physician before you use this, and your doctor knows nothing about cosmetics, what good does that do you? Right? We keep turfing this back to ask your doctor, ask your doctor, ask your doctor. But what if your doctor doesn't understand it? That's the key. Your doctor has to have the integrity to say, I understand your question. I'm not the one to ask. I don't know about that. Not, oh, I saw a headline of an article. Yeah, it doesn't do anything. That is doing a disservice to the patients. All right. Anyway, off my soapbox. But I wanted to give you yet another example, very recent, about where research really isn't good, solid research, and where you are likely to be misled when you hear the headline. So when you hear that headline in the next few weeks about vitamin D doesn't really do anything for heart disease or fish oil doesn't do anything for heart disease and cancer, just understand it's pretty much a bogus article, and people that really stand by that either haven't read the article or they've read it and they do not understand the science and the physiology behind it. All right, let me know what you think about this. Just a little public service announcement for you. Ask your questions or argue with my interpretation if you've read the article. I'm happy to discuss it. And let's see if we can't get some discussion going. People need to understand that science is not a clear answer. Science is marketing, and you still have to read it and be aware of what it says and understand the nuances behind it because you're being played. All right, that's it for today. Thanks for watching. Until next time, eat for your health, train for performance, and live the life you love today. Thanks.